The enteric-coated tablet form of diclofenac is used to reduce pain, swelling, and joint stiffness from arthritis. This medication is a non-steroidal anti-inflammatory drug, Nsaid, that works by blocking your body's production of certain natural substances that cause inflammation. By doing so, it helps to decrease swelling, pain, or fever, allowing you to do more of your normal daily activities. It's important to talk to your doctor about non-drug treatments and using other medications to treat your pain. The daily dosage and optimal timing for taking this medication should also be discussed with your healthcare provider. Before taking Inavix 75 mg to 0.025% kit nonsteroidal anti-inflammatory, Nsaid, and Salicylates, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 2 to 4 times a day with a full glass of water. Do not lie down for at least 10 minutes after taking this medication. If stomach upset occurs, you may take it with food, milk, or an antacid. However, this may slow absorption and delay pain relief. Swallow the tablets whole and do not crush, chew, or break them. Different brands and forms of this medication are available, so do not switch forms unless your doctor tells you to. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. To reduce the risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or take this drug more often or for longer than prescribed. For certain conditions, it may take up to 2 weeks of taking this drug regularly until you get the full benefit. Make sure to tell your doctor if your condition gets worse. Some common side effects of Inavix 75 mg to 0.025% kit nonsteroidal anti-inflammatory, Nsaid, and Salicylates may include upset stomach, nausea, heartburn, diarrhea, constipation, gas, headache, drowsiness, dizziness, or blurred vision. If any of these effects persist or worsen, it is important to consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. This medication has the potential to increase your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. Seek medical attention immediately if you experience any serious side effects, such as changes in hearing, mental/mood changes, easy bleeding or bruising, difficulty swallowing, or symptoms of heart failure. In rare cases, diclofenac may cause serious liver disease. Seek immediate medical help if you experience symptoms such as persistent nausea or vomiting, loss of appetite, stomach pain, yellowing of the eyes or skin, or dark urine. While a serious allergic reaction to this drug is rare, seek immediate medical help if you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so it's important to consult your doctor or pharmacist if you notice any other effects not mentioned here. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Non-steroidal anti-inflammatory drugs like Inavix 75 mg to 0.025% kit may rarely increase the risk of a heart attack or stroke, especially if taken for a long time. This risk may be higher in older adults or those with heart disease, high blood pressure, or diabetes. It may also rarely cause serious bleeding from the stomach or intestines, especially in older adults. If you experience stomach pain, black stools, vomit that looks like coffee grounds, chest pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes, seek medical help immediately. Be sure to talk to your doctor or pharmacist about the benefits and risks of taking this medication. As for the optimal timing and daily dosage, always follow your doctor's instructions. Before taking Inavix 75 mg to 0.025% kit, it's important to talk to your doctor or pharmacist about any allergies you may have to diclofenac, aspirin, or other NSAIDs. Also, make sure to inform them about your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, or stomach/intestinal/esophagus problems. It's important to stay hydrated while using this medication, especially if you are an older adult or have heart failure or kidney disease. Be aware of any changes in your urine and seek medical attention if you notice anything unusual. Inavix 75 mg to 0.025% kit may cause dizziness or drowsiness, so be cautious when driving or using machinery. It's also important to limit alcohol and stop smoking while using this medication, as they may increase the risk of stomach bleeding. This medication can make you more sensitive to the sun, so be sure to limit your time outdoors and use sunscreen. Before having surgery, make sure to inform your doctor or dentist about all the products you are using. For women of childbearing age, it's essential to discuss the benefits and risks of using this medication with your doctor. If you are pregnant or planning to become pregnant, talk to your doctor about the potential harm to an unborn baby. If you are breastfeeding, consult your doctor before using Inavix 75 mg to 0.025% kit. When taking Inavix 75 mg to 0.025% kit, it's important to be aware of any potential drug interactions. This medication may interact with other drugs, which could affect how it works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Inavix 75 mg to 0.025% kit include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, methotrexate, and water pills, diuretics such as furosemide. It's also important to note that this medication may increase the risk of bleeding when taken with other drugs that may also cause bleeding, such as antiplatelet drugs like clopidogrel, and blood thinners like dabigatran, enoxaparin, and warfarin. Furthermore, it's essential to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to diclofenac, the active ingredient in Inavix 75 mg to 0.025% kit. These drugs may increase your risk of side effects if taken together. However, if your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking it unless your doctor advises otherwise. If someone takes too much Inavix 75 mg to 0.025% kit, they may experience severe symptoms such as passing out or trouble breathing. In this case, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. Symptoms of overdose may include severe stomach pain, slow or shallow breathing, and extreme drowsiness. It's crucial to take the correct dosage of this medication to avoid these potential risks. It's important not to share Inavix 75 mg to 0.025% kit with others. Your doctor may also recommend lab or medical tests, such as a complete blood count, liver/kidney function, and blood pressure, while you are using this medication. It's important to keep all medical and lab appointments. Additionally, making some lifestyle changes, like weight loss if needed and strengthening/conditioning exercises, may help improve your flexibility and joint function. Be sure to consult your doctor for specific instructions. If you happen to forget to take a dose of Inavix 75 mg to 0.025% kit, take it as soon as you remember. However, if it's almost time for your next dose, then it's best to just skip the missed dose and take your next one at the regular time. Do not take a double dose to make up for the missed one. Make sure to store Inavix 75 mg to 0.025% kit non-steroidal anti-inflammatory, Nsaid, and salicylates at room temperature in a tightly closed container, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When you no longer need the medication or it has expired, be sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. As always, it's important to follow the recommended dosage and timing for this medication. Be sure to talk to your doctor or pharmacist about the best time to take it and the potential benefits for your specific concerns. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.